So what the heck is collagen? Why is it useful? And why might we want to be taking more of that for our joints if we're interested in having our joints for a really long time, functioning at a high level, instead of having them replaced? I'm Dr. John Tait. I'm a non-surgical orthopedic doc, and that is what we're going to talk about today is collagen, because collagen has been a big thing probably the last 5+ years. If you go into any grocery store now in America and you go to the supplement aisle, you'll probably see a few dozen collagen products. And we really have to understand, first of all, what is collagen? What does it do in joints? And then the most important thing, if we're doing this strategically, maybe to encourage better health in our joints, what is the right type you need to be taking? So that's what we're gonna walk through today. So first of all, collagen, if we understand what it is, collagen gives us the elasticity in our tissues. And this could be the elasticity in our skin. If you see anybody aging around you, or yourself included, you've probably noticed that your skin doesn't look quite as youthful, plump, and resilient as it once did, and it's maybe a little saggy or wrinkly, and hey, that's life and that's aging. But part of that aging is because of collagen depletion. So in our later 20s, tipping into our 30s, we start to deplete our collagen reserves in the body. This is why people don't look quite as useful unless they're getting a lot of work done and getting a lot of aesthetic upgrades on their face. But I'm talking about joints today, not aesthetics. But that is a big distinction between these products, because a lot of the collagen products out there are catering to the beauty side, okay, to help that more plump, youthful, resilient appearance of skin, or have stronger hair and nails, which is great if you need that. But that's what we term whole body collagen, right? That's targeting some of those things. Because there's at least 12 with subtypes up to 20+ types of collagen in our body. So depending on the structure, we need different types of collagen. So if we look at joints, okay, ligaments and tendons surrounding joints. So ligaments connect bones together, okay? Ligaments have a lot of type 1 by weight, type 1 collagen, so do tendons. But type 2 are the primary types that we find in joint articular cartilage, as well as the fluid, right? So the component makeup of a joint, if we look at that, is a lot of type 1, a lot of type 2. If we look at other types inside of cartilage, it's an easy math problem. 2 + 9 = 11. So types 2, 9, and 11 are the ones that are most commonly found scientifically if we analyze those in cartilage. And you probably won't find a whole lot of 9 or 11 in products out there on the shelf. You'll find a lot with type 1s, type 2s, and those are the ones that we want to target more, that have a better chance of helping joints if that's what your target is. Because if you're taking a lot of products that have other things in them, other types of collagen, or you can't even tell from the label, but on the front of it, it probably says something like helps joints, because that's a true statement. Collagen helps joints function better, because collagen is the infrastructure, the scaffolding, that the connective tissue fibers that hold things together, whether it's a ligament, tendon, or the cartilage structure. Because inside of cartilage, we have these collagen threads, and then we have molecules like glucosamine stuck within that scaffolding. And that's the component makeup of joint cartilage, which is why, if we carry this over to why might resupplying that be useful? Well, because we can resupply what we're depleting and degrading and deteriorating and aging over time. And that's where this whole collagen boom came about, to say, well, if we take this stuff in, might it be useful to us? So way back in the day, wasn't around at that time, but it was like in the 60s or maybe tipping into the early 70s, people were taking a lot of gelatin products. And those are collagen derivatives. But the problem with that is that the type of the collagen, the size of that molecule, was way too big to probably be absorbed. Now, some people reported feeling better on this stuff, and that's what we call placebo, because you're taking something that you think is going to help you, so it did help some of those people. But scientifically, if we look at it now and we look at what that stuff was and the molecule size of it, by the time the body digests it down, can it really get to the individual molecule size that then can be delivered through our bloodstream and then pushed up into that cartilage or the ligaments and the tendons through the very small capillary network that supplies them? Not likely. Fast forward to current day, if we look at the types of collagen, there's a couple big ones when we're looking at products, okay? You'll see something called hydrolyzed, which means we've broken that collagen down somewhat to a smaller form. That smaller form should be more digestible, more absorbable across the gut into the into the bloodstream and then deliverable through the bloodstream to the target structure, i.e. the joints in our conversation today. So what you're learning so far is you need more of type 1 and type 2. You need probably a hydrolyzed version, that's what you're looking for. And then the last component you can look around for these joint products is there has been studied formulation of these type 1 and type 2s in clinical research, and they go by branded names. So if you look on the label, like if you pull this one off the shelf back there, you'll see there's a couple branded, registered, trademarked versions of collagen, and those are backed by clinical studies, both in humans and in mice models. So it's fun to study things in mice. That's where a lot of our drug development and molecule development, we're using mice or rats as kind of a model to simulate what would this do over here in humans, very commonly in clinical trials. And in those studies where they're studying things like Fortigel or Tendoforte or some of these branded type of collagens, they would genetically give the mice arthritis, so they can knock out genes where the mice unfortunately get arthritic knees. Then they would feed some of the mice collagen and not feed the others, and then they would let them live for a while, and then they would kill all the mice and look at their cartilage. So again, this isn't not trying to say anything. We like animals on the program here, but that's how we do science. So they looked at the mice's cartilage that took the collagen and ones that didn't. And what they found was that the ones that did take this had healthier looking collagen. So then they took that over to humans, and of course we can't run the exact same experiment because it's not good clinical research to harvest people and look at their joints, but they would ask them questionnaires instead. So they would, again, blind people to this, feed people the active collagen and ones that had just a placebo version of it. And most of the people in those studies that reported benefits had significant reductions in pain, stiffness, and functional improvement. So again, with any study like that nutritionally, nutritional science is very hard because there's a lot of other variables that go on in our life every day. But in the studies, and the best we can do it with those types of studies, it's patient report of how they feel. And so I think that's the best way to kind of tie this video in at the back end is if we know that we're getting the right forms. Okay, you're getting type 1, you're getting type 2, the things that your joints need. You're getting a good form of it from a very reputable company that has high standards in testing, and you know that. And then it's probably a hydrolyzed version of those collagen peptides. Then you got to run the experiment internally. Okay, you have to take it for a period of time so you can see the result. And that would probably be 1 to 2 months for most people to see can they have a clinical effect that they can appreciate with everything else in your life relatively held steady, which again is challenging because every day of our life is different. But again, that's probably going to be the intake that you need or duration of that intake to see a clinical benefit from something like a collagen product. So if we look at longevity for joints, is collagen a good spend? Probably, right? Do we have empirical data to support it? We don't. So I think that's an experiment, and it's a budgetary consideration for yourself. I've been taking collagen for years. I think there is benefit for me personally, but that doesn't mean there'll be a benefit for you. So I wanted to give you the down and dirty on collagen products today because there are a lot of dirty collagen products out there. There's ones that are making big claims about joint health, and they're probably going to do very little for your joints because you're taking the wrong form. So hopefully that was helpful to you today. If you like stuff like this and want to learn about other supplements, drop it in the chat below so we can see what other videos to detail on supplementation, specifically around joint and musculoskeletal health is my sweet spot. And if you want to see more videos when they do pop up, subscribe to the channel. And as always, in the description below, there's a link to my practice. If you're local here in Tucson or the Southwest, and we can help you in any way, then you can fill out that form, talk with somebody on my team about how we approach pain management, which is really pain elimination in my practice is what we're aiming at, and turn you back to a life that's more active so that your joints live longer and you can experience more things over the journey ahead.